Good evening. Lloydminster RCMP are looking for a suspect wanted in connection with an armed robbery that took place in the parking lot of a local hotel on June 11th. Now, 2 others have already been arrested in the case. 26-year-old Stephen William Thorne and 25-year-old Timothy Richard Gunn have been charged with multiple violent and firearm offenses and are currently in custody. So now police are looking for this accomplice. 25-year-old Sara Elizabeth Manners is considered armed and dangerous and should not be approached in public. She is known to frequent the Lloydminster, Saskatoon and Edmonton areas. Now, if you know of her whereabouts, you are asked to call the Lloydminster RCMP or Crime Stoppers. Now, police say the armed robbery was not a random event and was related to the illegal drug trade in Lloydminster. Now, as for Timothy Gunn, he was actually arrested by Saskatoon police in that city. Police received a report of a black truck being driven erratically late yesterday afternoon. The suspect vehicle did not stop and a pursuit began. Now, Gunn is reported to have struck several civilian vehicles and then a police cruiser. The pursuit continued and the suspect vehicle was involved in 3 more collisions with motorists. Now, the vehicle was then driven towards an officer who fired shots at the driver. Police officer deliberately rammed his cruiser into the trunk after that. Now, the suspect then fled on foot. Timothy Gunn was captured with the assistance of the K9 unit. No one was injured in the incident. Gunn is remanded into custody and returns to court next week. Meanwhile, the other person we mentioned who was arrested, 26-year-old Stephen William Thorne, well, he was arrested on break-and-enter charges for an incident at a home on June 13th. Now, also charged in the incident is 30-year-old Jared Daniel Haritzuk and 40-year-old Jason Roy Miller. All 3 remain in custody. Police say during the incident, a man was assaulted by the accused. Now, they will appear in court on July 8th. Police say this was not a random attack and is associated, again, with the illegal drug trade. Well, after more than 8 years of pushing for change from both local and provincial governments, the Lloydminster Concerned Citizens for Senior Care Society's request for a bi-provincial report has been answered. Now, the Integrated Health Services Needs Assessment report covers a wide number of issues from plan changes and recommendations to health facilities to the need for doctors, spaces, and more. And now the group says it's time to take action. Anna Stanislaw has a story in this week's Healthy Living.
Rod Sellers, co-founder of the society, was happy to see the report released, but says it's only confirming what they've known for many years. The #1 issue that was covered in the report is the lack of funding from both provinces for the city.
The report compares Lloydminster to various other communities of similar service areas, particularly Prince Albert and Medicine Hat. And it shows that we're far underbedded in all areas. I mean, way underbedded, like by half or more.
When you just look at the numbers of the things that this community does not have, and smaller communities have it in spades, you know, the funding should have been started 2 years ago.
This includes mental health inpatient beds, surgery beds, and long-term care beds. Sellers says this and the shortage of assisted living beds is the biggest concern.
They've admitted in this that we're immediately short 44 long-term care beds, which we have known for years.
Most people that are aging would rather be in their home. They'd like to stay at home as long as possible, and we'd like to see that for our people in the community.
Mayor Rob Saunders was an integral part in bringing the 156-page report together. He says all the areas that have been identified in the report need to be addressed.
It's just how they're going to be prioritized in the timelines, and that's up to the provincial governments to help out with that. The next stages would be a memorandum of understanding that the 2 provinces will come together, or the 2 ministries will come together and agree on that understanding of the healthcare services needs for Lloydminster.
Society member Linda Graham says the bi-provincial report is what they've been waiting for, but not the results they've been looking for. Graham says they were promised a feasibility study for the Dr. Cook Extended Care Centre, but it didn't come through because of lack of funding. I
don't think that you can base a decision as of the magnitude of demolishing a building when we have a crisis in seniors' care without a feasibility study.
Mayor Saunders says the ministries are reviewing the report and is asking for patience.
There is some good work that's been done. There's more good work that will follow, and we do have the engagement of the ministries, so we want to continue on with that.
Sellers says they've been appealing to the ministers for years, and with the new report will be meeting with them soon to continue pushing for action.
We've got the data. We've got the problem. Let's solve it.
Anna Stanislaw, Newcap News.
All right, if you would like to review the report, you can do so on the city's website, and that is at lloydminster.ca. Well, the border city was the stop today for Shriners Club as they continued their cross-Canada tour, raising money for a new major children's hospital in Montreal. Now, the group had a visit at City Hall this morning before continuing their 17,000-kilometer journey to Victoria, BC. Bart Petiasic reports.
Pulling up in a drivable Shriners Fez, tassel and all, the Montreal-based group took time to meet with the mayor and local supporters before they continue their exceptional care odyssey, helping support the Shriners Hospital for Children. Melanie Béliager knows about the Montreal Hospital well. Her daughter Maya was diagnosed with fibular amelia when she was young, meaning she's missing a bone in her right leg.
Prior to the Shriners, the first hospital considered amputating the foot, but then we got a second opinion at the Shriners and they said might as well try to keep it.
While there's only one Shriners Hospital in Canada, it's part of 21 healthcare centers across North America, servicing approximately 200 patients in Alberta alone.
It's not like no other hospital. You get there, they know your name, they know the name of the child, they'll salute you, you have coffee there, it's like being at home.
We do treat in Canada kids from all the communities across the country, and we are able to do so at no cost to the families because we have our Shriners who take care of all of the transport, lodging, and getting the kids that need the care to us.
Now Béliager and her daughter have joined the Cross Canada tour as they help encourage others to donate to the cause as they try to raise $130 million to build a new Montreal hospital.
Being part of the Odyssey is for us a chance to give back what we've received and to meet with the Shriners and encourage them to continue their work.
Bart Petiasic, Newcap News.